Uh, I want to ask you about a different topic right now, very popular these times. What kind of high-tech technologies does Takeda use in patients' projects?
Well, it's interesting you ask, because you have one project that has delivered more value than we thought, and value in terms of improving patient care. A lot of patients, coming back almost to what we discussed in the beginning, suffer from stress also when they come to the hospital. When they need to get an infusion, for example, when they have a form of cancer, when they need to get an infusion, when they have inflammatory bowel disease, going to the hospital is not fun. They are there and they're stressed. So we've developed a solution using VR goggles that they put on, and then there's a game that is not only distracting, but allows them to fight their disease when they're having the infusion. And we've actually evaluated that with the healthcare professionals and with the patients who've collaborated on it, and it significantly reduced stress. It also made time pass much faster. So in an infusion, for example, that took 30 minutes, it only seemed like a few, and hop, it was over again. So that made the experience that they still have to have in the hospital, because it's unavoidable despite all the therapeutic progress we have, a much better experience for them.
I would like to ask you about your office right now, because there is something really interesting for me. At the entrance in Takeda's office, there is a very interesting piece of decoration. I mean, it's a tree with paper origami, right? Yes. Was that your idea?
Well, what I wanted to do when we have a new office is reinforce our purpose when you come in. Because, and I'm, as said, very privileged to work with people who are fueled by their passion to make a difference in patients' lives each and every day. So we thought, how wonderful would it be that when we get into the office, that's the first thing we see. And then we started talking with the team, what would be the right way to visualize that? And when together we came up with the idea of a tree that indeed had origami birds on it. And those origami birds are a Japanese tradition.
Yeah.
When you visit someone in the hospital, they write a wish and they give that bird to the patient in the hospital. Takeda is a Japanese company, so we want to also dive into our roots, and this fits so nicely with bringing hope. We thought that's a good way to do it. But rather than bringing it to a patient in the hospital, we now use it to, whenever we make a difference in patients' lives, we write that example down on the bird and we hang it in the tree. So that when we come into the office, the first thing we see is all these birds representing all these moments where someone of the company has made a difference in patients' lives. And that truly is inspiring when you come in. And I hope that, you know, when COVID will be behind us, we will be able to be inspired by that every day when we come in to make that difference for patients' lives.
May I ask, what have you written there?
What I've now written, for me, it was more a wish. I am a bit further away from directly in hospital due to my role. So I wished for patients, that patients could be treated according to medical guidelines in Poland. Because not in all cases that is currently the situation. Sometimes there are other considerations that I understand sometimes why they have been taken, but that take precedent over being treated based on medical guidelines. So my passion, my vision, my hope for Poland is really that all patients will receive treatment according to medical guidelines and medical need.
Let's stop for a moment at this topic. I was wondering about the tree. What does it symbolize to you in a patient organization cooperation context, or general in patients' culture?
What's possible? Each bird represents something that has already been done. I hear a lot of people talking that the Polish healthcare system is a challenging one, and it might be a challenging one, but so much is possible. So for me, it represents possibility and hope. And that's what we try to establish every day. Not only now, because even if something is a few years ahead and we know it will take time to change, because some of the changes can be tough, still that tree bringing hope will inspire us and engage us to not give up and to continue doing that.
What are the ways in which Takeda ensures patient centricity in top of mind of every employee?
The tree that you have at the entrance is, for example, one clearly there. You cannot come into the office without seeing it.
Yes.
And it is, like we say, the minute we start working in a therapeutic area, we start by the patient journey. And we do that cross-functionally so that everyone who works in a therapeutic area, we don't say also product or brand, we talk about therapeutic area, which in a way is already more patient-centric than traditionally only promotional or commercial. Everyone should realize what patients go through from the moment of the first symptom till the moment in the treatment where they are and when we can make a difference. And having that as the starting point of how we can create ecosystems to deliver that holistic patient experience, having those examples shared is one of the examples. Also, disease awareness days are very important. Like I said, we don't want to only create awareness outside of Takeda, but also inside. And not everyone is as close to healthcare professionals as possible. We also have people working in finance, in HR, roles that are traditionally a bit further out. But we want to make sure that everyone understands what we try to reach, what our purpose is. So for that, we also have internal awareness days. And then we can have someone from a patient organization share something about a disease, a healthcare professional, someone also from the organization within Takeda to say what we're doing in that field so that everyone really understands. Even when you process a payment, even when you draft a job contract for someone, you know that job contract is for someone who's making a difference. You know the payment is to pay for part of that ecosystem. And that can also fuel them for everything they do every day.
Tell us about the PTRD model. What does it mean?
It stands for Patient, Trust, Reputation, Business. And it basically is a decision-making model that is used in Takeda globally. And it is a way our current CEO, Christoph Weber, has translated our Takeda values, which we have since the beginning of the company till today, into a decision-making model. So every time we have to make a tough decision, we first ask ourselves, is this good for the patients? Okay, then we go on. Does this build trust with society? Does it reinforce our reputation? And then we assume business will follow. And it does. But business does need to follow as well, because we need to be sustainable as well. I mean, we're also not an NGO, we should still be here next year. But the starting point of the decision-making process is the patient, but also trust and reputation are there. Because sometimes things are good for patients, but if they are on an unstable foundation, and we might have to stop them 2 months later, that might not be good for our reputation to create confidence in the future project we want to do that will deliver value. So we really need to look at that precisely and in a detailed way to make sure that whatever we do is the right decision, starting from the patient.
How to reinforce and empower patients' role in Polish healthcare system?
That's the million-dollar question. It's a very challenging one. And it's also not one that we can or should do as Takeda by ourselves. If we want to sustainably embed the patient's voice in the Polish healthcare system, that should also start with the patient. But it should also be acknowledged by ministries of health, policymakers, healthcare professionals and all that. But it starts by making sure what incorporating the patient's voice adds in terms of value of decision-making about anything dealing with the patient journey, whether it's on diagnosis, whether it's on how to treat a patient, not just therapeutically, but also in all other ways. So making sure that value is seen and recognized is a very good starting point.
How can Takeda strengthen patients' organization voice in discussion with stakeholders?
It also starts very often, again, by partnership and mutual understanding also of each other's needs. We need to understand what those needs of those stakeholders are, and of course what the needs of the patients are, and where do they meet and where not. And if not, why is that? It's very often easily assumed that budget plays a big role in Poland, and we know it is a challenge. But is that always the case? I don't think so. So really starting bringing parties together, having an open dialogue on what everyone's real need is, and then finding creative ways to come up with those solutions together, I think that's an excellent starting point there.
Thank you for a conversation. It was very, very interesting for us to listen all about these solutions for patients that empower them. That's a great example you give. And I hope that all the wishes from your Takeda's tree will be fulfilled as soon as COVID-19 will be gone.
Exactly. Test mam nadzieję. It's very important indeed for Polish patients, and we'll do our utmost to contribute to that. And thank you very much for giving us the opportunity to share the way we try to add values to patients' lives.
Thank you very much. Dziękujemy Państwu bardzo za rozmowę.